PR Connections Radio presents. This episode of Watching Mental Health is brought to you by Classy Communications PR and Advertising. Classy Communications provides public relations and marketing solutions for businesses, professionals, and non-profit organizations. They can deliver the true meaning of your business with press releases, social media marketing, web development, email marketing, book publishing, and much more. Wherever your potential clients are, they can help you connect with them. Visit classycommunications.net to learn more about their suite of services that can help your business stand out from the rest. Classy Communications is your solution for business success.
Welcome to Watching Mental Health, where we break down the stories, stigmas, and research in mental health. It's time to have an open conversation. So let's talk about it. Hi, everyone. Welcome to another episode of Watching Mental Health. And I am very excited because today we're going to talk about a super important, timely, relevant topic that I think is at the top of mind for a lot of Americans. And my special guest today is Mendi Baron. He's a nationally recognized expert in teen mental health and in family-related issues. With years of experience providing therapy, consultation, and intensive coaching to both adolescents and families, Mendi understands the complexities of teen mental health issues that are common today. Whether you're a parent grappling with your teen's challenges or you're a young adult navigating that tricky transition into that adult life, which I think I'm still trying to navigate, Mendi is here to support your journey. And I'm really excited because he's going to come on and we're going to talk about practical strategies, personal stories, and really just the reassurance that you're not alone and that no situation is too challenging when it comes to youth mental health, teen mental health, and family mental health. And so with that, let's bring Mendi to the show and welcome him to Watching Mental Health.
Hey, how's it going?
Doing well. Thank you so much for joining me today. And I'm really excited because you are a referral to me as a guest. And so I don't really know too much about you. So with that, I just want to start us off with asking a little bit more about, who you are and why, mental health is important to you and why teen mental health in particular or youth mental health is the specialty area you've gone into.
Sure. Well, so my name is Mendi Baron, as you surmised. I'm an LCSW, so I'm a licensed psychotherapist. There's a particular thing about teenagers, right? Not that I've written off adults, but with teens and kids, if you can give a little bit of redirection at a younger age, you actually get the advantage of seeing the results of your work. A lot of times when you work with adults, you don't always see it. With a kid, a small adjustment can go a long way and change the complete trajectory. So there's an advantage in the sense that you can see your work play out, which for a lot of therapists is really a wonderful thing because you don't always get to see that.
Right.
Alternatively, kids know everything and can't learn anything. And so there's some challenges there, but it was a particularly interesting field to me because of that. And so I gravitated toward it. I kind of gravitated to that population. It's a nuanced population, a challenging population.
Right.
I think that, parents always say, oh, my teenagehood was the best time of my life. And they're like, well, you got puberty, you got friends, you got social media pressures, you have body image, you have school, you have college, there's a million things that you're navigating just going uphill. So teenagehood is not as, exciting as one would imagine.
So that's funny that you say that because I've always thought back when I was thinking about maybe being a teacher, I always thought, I could be a teacher for elementary school kids, but middle school, like that's when for me it all goes downhill. Like I hated my middle school years. I was not a fan. And then, as you said, teenagers can be, they think that they know the world and that can be a challenging time. And so that's funny that, other people are like, oh, I think teenagers were so easy. Being a teenager was so easy. Because I don't think that that's necessarily true. And I think that that's probably so untrue compared to how it used to be because of the technology, and internet world that we live in. So talk to me more about that. Do you think that that's really had an impact on teen mental health?
Oh, absolutely. One example, I can give you a few, but like take bullying, right? Back in the 90s classic movies with the mullets and such, when you were being, bullied in the schoolyard, some guy named Biff, who was a jock, was beating up the nerd with the pocket protector, push him down in the schoolyard. Everyone watches. The kid goes home, licks his wounds, and in the classic movies, he comes back and takes revenge or whatever. But now, and that was limited to the schoolyard and the parents and the group of kids.
That area.
Nowadays, correct. Nowadays, when you're bullied, it's not just the schoolyard. Out come the cell phones. Now you're across social media. Now you're on the internet. Now 10 other schools are watching. Now you're everywhere. And for teenagers, I mean, we already know that being on the internet is that you're there. That's it. And there's a sense of permanence that really impacts teens far greater. And more often than not, although thankfully a little less recently, we see a lot of teen suicides for that reason, because life as they know it in their minds is over, and they think very permanently in black and white in that sense. Secondarily, obviously we all know social media, body image, our kids are being exposed more and more toward what is supposedly the perfect form. Now with AI, they're generating models that look even better than the real people.
And we could never be an AI model,
Correct. So we start implanting unrealistic expectations. Again, back in the day, the newspapers or some magazines. Right now, you open your thing, it's just everywhere. And so you have unrealistic expectations. You have the influence of influencers, right, doing stupid things like drinking challenges and dying of alcohol poisoning, or in Las Vegas, actually last week, a bunch of teenagers tried to stage like a takeover of some kind of shopping mall. That's a way to get shot pretty quickly. So it's the influences that they're seeing also that lead to a lot of negative behavior. And then I can go on, but the fourth one that also, people don't often think of is the expectation, right? You're seeing people who are rich, who are wealthy, teenagers who are making millions online. And so you have this internal expectation that you build that, hey, I don't need to go to college. I don't need to do any of this. I can just hit it rich by doing X, Y, or Z. And then when it doesn't happen, that sense of failure is just crushing.
Yeah, that's really hard. And that is crushing. And it seems like you touched on a few really key reasons why why we're in such a youth mental health epidemic. And that word's been really thrown around for, really since the pandemic, right? It feels like we came out of the pandemic and entered into this youth mental health crisis that we have not been able to get past. And it feels like a lot of people are just kind of swimming in it and they don't know what to do. So what are your thoughts on that? Are we making any improvements in this epidemic? How can we make improvements in this epidemic? What are your thoughts there?
Sure. The epidemic had a massive impact. I think teen suicides went up like 300%, eating disorders like 800%, self-harm, the hospitalizations were up like 1,000%. The epidemic represented an epidemic of solitude, right? You're talking about kids who are in their developmental stage, whose whole lives surround social interaction, who are cut off from their friends and the world as they know it for 2 years, compounded with the imminent fear of death at all times, compounded with lack of access to resources, right? You're not going to go out to your therapist during a pandemic. It's going to be a lot harder. Combined with just constant exposure during boredom to social media and all the things we just talked about. It's an epidemic in and of itself brewing right there. And kids lost 1 to 2 years of just socialization, right? Just basic interpersonal skills. So the pandemic really did lead to an epidemic. And we're still seeing the results, and we will see the results for quite a while.
That's too bad.
Yeah. In terms of things to do about it, it's challenging, right? When I talk about clients, I refer to them as clients, not patients, because patients are things doctors come in and fix them, right? Clients are people you help themselves. And it's very hard to help somebody regain 2 years of their lives. And it's very hard to help somebody get over the trauma and anxiety, that the world's going to hell in a handbasket. And you're afraid of, something happened to you. They still walk around on it.
It's still very present, that going to hell in a hand, even for us adults, right? We walk around with our heads because we're just so freaked out by the world.
Correct. And you look on the news now, it doesn't help, right?
No.
Everyone's dying everywhere. Things are exploding. People are fighting.
It's terrible.
It's a really crazy time to live. So that pressure really hasn't come off. And has actually caused more of a pandemic of anxiety nationwide. But things to do about it right now are not really about fixing the past. They're about being present and moving into the future. For one thing, parents, obviously parents have to work, and not every parent can afford to put in the time necessary to be there. But as much as we can as parents, being present for our teenagers, right? It's one thing to show up when things have already happened, right? When you've caught them in whatever, or they've done whatever to themselves.
Yeah.
But to create moments, to set a stage sort of for communication is critical. Whether that's like, okay, we're going to do dinner together twice a week, and for 30 minutes, we're going to put our cell phones down, right? Or I'm going to take every Saturday, or every Sunday, I'm going to take an hour and do whatever, so that you create a moment for your teenagers where they know, hey, it's a chill time. It's a time where there's openness, where there could be dialogue, or where there's nothing at all, but there's connection, right? So that's part one. Part two, where we're really lacking, is schools and training, right? So kids are in school 2/3 of their lives until they're 18. So the school in some way, which we shouldn't do, but parents leave the schools to raise their kids. And the schools are not adequately prepared from a mental health standpoint, certainly, to deal with that. And so a lot of kids, back in the day, fewer kids struggled and you're able to catch a lot of them. Some you didn't catch. But now more than 50%, right? The numbers are just astronomical. And so you don't even have enough staff or funding to catch the issues before they arise. So I think federal funding or funding for schools and more focus on mental health, greater training for teachers on recognizing mental health, right? What is a teenager being a teenager versus when am I looking at something more serious?
Right.
So those are pieces of it. And then the third piece is regulation. Parents often fear setting boundaries for their teenagers because they're afraid to cut them off or have them pull back. Because of that, parents walk on eggshells around their kids. Many try to be friends with their kids. And many struggle to hold boundaries, things like bedtime, things like screen limits, things like where you go, when you go, with whom you go, things like use. So many more parents are like, well, my kid's smoking pot, but what am I going to do? Right. But, and pot, people, pot isn't so bad when I was, but the pot of today is pretty darn bad. It's very different. Teens' prefrontal cortex is still developing, and it shrinks it. The prevalence of adolescent onset schizophrenia is increased exponentially because of the use of such substances. So they actually have quite a greater impact. And third, not everyone who uses not everyone who smokes pot uses heroin, but everyone who has used heroin started with pot. So there's a connection between filling a void and filling a void. It's not that one is a gateway to the other. So when you start using one to fill, then you keep going. And so parents are being a lot more lenient and lax with their kids, thinking it's nothing, but what the kids are doing is self-medicating. And so setting boundaries is the third piece that I think parents struggle in, and really not recognizing that in some sense, setting boundaries is the ultimate form of love in this kind of situation.
Yeah. Wow. That's so interesting. Especially the pot thing, that's new. And I think that a lot of parents, especially younger parents, they want to be cool and, they think it's not that big of a deal. But yeah, I mean, setting those boundaries is so key. And you touched on a few really cool, I think, important things that parents can do. Just something as simple as, those nightly dinners where you're shutting the screen off, just small little actions. And so I love that you touched on some of that. So if there's any other, recommendations that you have for parents, definitely touch on that now, but also any recommendations that maybe you have for teens who are struggling and maybe not sure, where to turn or what to do.
Sure. Parents, I can go on and on. I have a book coming out about it, but I mean, I guess one thing I'd add for parents is, and I tell this to parents a lot, especially when they show up, in my office, and that is, parents have a lot of guilt when they show up. What did I do wrong? Where did I fail? I must have done this. I shouldn't have done that. The divorce did X, did Y, did Z. And there's tremendous guilt. And so the first thing I tell parents is take off the guilt. It's not helpful in any way, shape, or form.
Right.
Kids aren't born with a manual, right? The manual didn't come out in the delivery room. So it's okay to make mistakes, but it's about what you do next. And what's most critical to do next is get educated. Right. There are so many things our teens have access to today that we have no idea. Like if I said proxy servers, parents still don't know what that is, but that's 5 years old. Right. Now we're well past that, dark web. So it's, getting educated as much as you can on that. And also as it pertains to mental health issues, consult experts, right? There are people who are trained. There are people who have the experience. There are people who have the information. There are books. There are shows. There's everything. So you don't have to try to invent the wheel or reinvent the wheel. Ask for help.
Yeah.
And help could also be from other parents, right? It could be like, share your experience with me and so on. And then one more thing for parents is to, you can use other parents, the school, coaches, people around the kids to create a village, right? Back in the day, when you reference back in the day, the village raised the kids, right? You could walk through and one person would help you with this, one person would watch out for this, one person educates you on this. And obviously we don't have that, but you could sort of create that. Which parents are involved in your kids' lives, which coaches, which teachers. And so you create a network where you communicate. Okay, here's what I saw. Here's what I noticed. Can you help with this? Can you help with that? We're so socially removed from each other
that's a great idea. We operate in these silos with our kids, and we don't have to,
Correct. In the information age, we don't have to.
Right.
So that's for parents. For kids, it's infinitely harder because our social circles are siloed, right? We have, back then you had your goths and your jocks and whatever. Now we got so many more variations. I can't even begin to count. And so for teens, it's a little bit harder. And you also can't really depend on your friends for advice. Right? And you can't depend on the internet for advice because you don't know who you're talking to.
Exactly.
And predators take full advantage of that. And we see that all the time. So for teenagers, it's really about asking for help. And it's very hard to go to your parents and ask for help. But in most states, as early as 12 years old, or at least the age that you can consent to your own care, you can approach a therapist by yourself.
Wow.
And you can ask for help, and they can keep it confidential as long as you're not a danger to yourself or others. And they can help you navigate those conversations with parents, right? But if you get a professional, that's your best bet. Unfortunately, they don't think that way. And so asking for help goes to the wrong people or comes from the wrong place. Obviously, you could reach out to teachers, but you still never know. School counselors are definitely good options. And if your parents are the kind of parents who can respond appropriately, obviously reach out to them and say, they may not have advice for you. A lot of kids are like, what the heck are my parents going to know about that? Right. Or they're going to react crazy to that. And just say, look, I don't want to talk to you about this. I love you. You love me. So for my sake, can you just find me somebody? I get a lot of calls like that. I got one today. Like, okay, my son wants to talk to somebody. I don't quite know what it's about, but he needs to talk to somebody about it. And that happens a lot.
Yeah.
Obviously if a parent cares about their kid, they're going to, do what's necessary.
That's sweet.
Yeah. Right. So that's the advice I can give teens. And on the flip side, don't open up to people you don't know. Don't open up to people who are going to be a negative influence. Don't take your friends, they're not experts. They may believe they have your best interest. They may be saying things they believe are correct, but most of the time you can't take that to the bank. And it can go the wrong way.
Yeah, absolutely. No, that's so true. And asking for help is so important, but really hard for, I think, adults even. So, for kids to ask for help, for teenagers to ask for help, that's tough, but that's what you need. And you're right, to ask for help from the right people or from the right sources that can get you to the right people.
Correct.
So let's talk a little bit more about those sources. You're here in Las Vegas, correct?
Yes, I actually travel back and forth. I live in Maryland. I'm licensed in Las Vegas. I'm licensed in Maryland. I do a lot of work as a coach sort of across the country.
Okay.
I do a little bit of, I'm licensed in California too. So I service a couple different.
So this is cool. This is cool. So my next question really then is a little bit broader. Mental health here in Las Vegas, I'm sure, as you know, youth mental health, we're 51 out of 51, right? We keep talking about it. What a fun number to say over and over again. But it's like, what are we doing about it? How can we be making a change? But you in particular, you have experience in different states. And so my first question around this is really just, what are your different experiences in different states? Is there something that stands out to you that Nevada is doing that makes it maybe more challenging for our youth here to get access?
Well, I'd say it's what Nevada isn't doing.
Ooh, okay.
Making it more challenging. I think if you look at where the legislature is directing funds, it's really not to that. In fact, the state was sued for failing to provide mental health care to a number of kids. I run residential treatment centers in Las Vegas for teenagers, and I can tell you they don't do a good job. Secondarily, as it pertains to insurance and coverage for the care, in California, there are regulators who hold the insurance companies responsible to pay for mental health care for teens. There's no regulator in Nevada. And so the insurance companies run amok and, like the Wild West, cover what they want, don't cover what they don't want.
They do. And then they sit there and say, oh yeah, we're practicing parity. We're doing this, but you're right. Nobody is watching them. And you look on those lists and they're ghost lists, you know, and they're not actually covering anything once you do find somebody that they might be in there. So it's really difficult to work with them.
Correct. Here. California has something called DMHC, Department of Managed Healthcare. You have the Department of Insurance. If an insurance company is messing around, not following parity, trying to discharge a kid too early, you can file a 72-hour urgent appeal or a 24-hour urgent appeal.
Wow.
And they will not just review it with their own team of doctors, but they'll ding the insurance company if you're right. They'll charge, a couple grand per client per day that they do this. Nevada is largely unregulated, does not have a very strong mental health system. The legislature is not focusing their funds there. And so, your youth are going to be the ones who suffer. Our schools aren't adequately funded. We don't have a lot of mental health practitioners in the schools. Our police teams are grossly underfunded. And so, we have gangs and all sorts of other stuff. Nevada's just not doing a good job. It's not about what we are doing, it's about what we're not doing. California is much more advanced in certain areas, not every area. But as it pertains to insurance coverage, as it pertains to mental health awareness, they start to do better. I use that word very lightly, but at least in terms of your ability to get coverage for mental health, California's pretty good. Their school system, questionable, but they still do invest a lot of money in that. Conversely, they've had a lot of people stealing millions of dollars, pretending to give therapy sessions to kids, but at least I think the mindset's in a better place.
And the fraud is there regardless.
Correct.
Yeah.
Maryland in particular, obviously there are no like huge cities in Maryland outside of like Baltimore. Baltimore is the second most dangerous city, I think, in the country. But outside of Baltimore, Maryland does invest very heavily in the school system. And obviously, unfortunately, they invest in specific places. And there's a lot of issues in parity in terms of demographics that have to be fixed. And they're actively trying to work on fixing it. But for the most part, in a majority of areas, they do have a pretty robust educational system. It's also, they don't have as many kids, right? It's more of a spread out state, more of a rural state. So maybe they don't have as much volume either. It's not a massive city complex. The income variables are different, right? There's a lot of higher income locations in perhaps Nevada. So there's a lot of different pieces that sort of contribute to it. But I'd say Maryland probably does well, California does okay, and Nevada just terrible. The second thing about Nevada is it does have a huge population in the hundreds of thousands of minorities who do not have access to quality mental health care, who from a traditional standpoint, the stigma around mental health care exists tremendously. And so even seeking help is somewhat problematic. And the unions that represent them put almost nothing toward that. And so they'll get, 14 days of therapy or, things like that. And it's very hard, A, to do that for certain minorities, B, to have the time to do that. If you're working 8 hours a day or 12-hour shifts to keep your family afloat, are you going to have time to take your kid to therapy? Wow. Very doubtful. So Nevada also has a massive population of underserved, overworking minorities whose kids also are being underserved as a result.
Need help. Yeah. That's tough. That's hard. And I'm glad that you touched on the rules, because people will say, oh, well, Nevada has a lot of rules, and so that's part of the reason. And that is, but that's not an excuse, right? Because there are plenty of other states that have rules.
The Nevada's rurals are underserved. When they say rural in Nevada, it means nobody's around.
Right.
In Maryland, rurals means, these are neighborhoods and cities, but they're more spread out. There's more, it's different. It's more rural than the rurals.
Right.
But yeah, I hope they turn this around, and I hope they start directing funds where they're supposed to be. Yeah.
I mean, the governor, keeps saying it. So we'll see, what happens with this legislative session too. But so what I'm hearing from you is, we need better regulations.
That's where it starts. Regulatory, it starts
on our insurance. We need more funding, and we need the schools. I mean, we need more mental health in our schools, which, I'm sure, as our schools are definitely a struggle down here in Las Vegas in particular. But we have a new superintendent. So, I'm on the side of hope, right? Like,
There's no
it's
other way to
tough,
think.
but there's nowhere to go but up, right?
Right,
Like, that's where
right.
I'm at, right?
Yeah, hope is a blessing and a curse, but there's no other option. Like, we can only hope at this point, right?
Yeah, exactly. Exactly. Well, thank you so much for your time. This was really, really valuable. I want to end on this last question that I always like to ask my professionals. I think I know what your answer is going to be, but I want to, just give you a chance to talk more on this. And really, it's about, if you think a mental health challenge or a diagnosis is something that is permanent, that is going to stick with you for the rest of your life, or is it something that can be overcome? And I found what you said earlier in the show interesting about how you can watch your clients improve just through small changes. And so I find that very interesting. And I'm also going to just caveat this with, we have so many schizophrenic, bipolar diagnoses coming down for kids younger and younger and younger. And it's heartbreaking to see. And so talk to me a little bit more about those challenges that these kids are experiencing. Is this something that we can do anything about, or is it just going to get worse?
You're gonna have to give me a few minutes for that.
Take it.
So let's start with the first thing, diagnostics, right? Diagnoses come from the DSM. It's a manual of diagnoses. Diagnoses are not meant to be a label. Diagnoses are meant to be a description of symptoms. So you can say, okay, based off what I'm seeing, here's what it might be, right? Because mental health is fluid and people can get better or worse or adjust. As they adjust, they can shift. Okay, well, now there was this cluster of things he was struggling with. Now this cluster slightly changed. So I'm going to call it this. Wow. But the label is not anything more than a description of symptoms so that you can go, okay, here's what I have to tackle. Right. So when people say, I have this or I have that, they don't have anything, right? They have a series of symptoms that is given this label, but those symptoms can change, right? And so I hate it when people are labeled that way. I know the fear parents have when their kids are giving diagnoses, so they avoid it. I know how the stigma works. And then sometimes you have kids who that becomes their whole brand. Right. I'm depressed. I'm a bipolar. And so their whole identity is formed around that. And so there's no hope after that. This is just what I am. Yeah. Right. And then there's the other pieces. Well, this is just what I am. So whatever, I'll do what I want. So, there are pieces of that. And so people don't tend to realize that this is a description of symptoms, which leads then to the diagnostic errors and challenges is that very often practitioners don't have enough time. Okay, so Nevada has a very, very few quality psychiatrists, if any at all. I know at least one group, there's maybe a second group, but they have very, very few, which means they have very little time. And so when you meet a kid and you talk to them, you have about 15 minutes to get as many of the symptoms as you can, but you don't always get them. And so a lot of times like, okay, well, these kind of qualify as maybe this or maybe that. And they throw some medicine at it and they see if it works. So a lot of times when we see things like schizophrenia, which I mentioned as it pertains to pot, it's often misconstrued. It's often a cluster of different symptoms. So for example, schizophrenia may have some explosive behavior. There may be some times where the client seems to be interacting with themselves, where there's what appears to be some kind of mania, some psychosis. But a lot of times when you're dealing with a kid on the spectrum, right, who's struggling socially and may converse with themselves because they struggle, you've completely missed the boat. And you've taken the parental interpretation of it and gone the whole wrong way. I have a client right now whose parents are unfortunately fighting a custody battle, but the dad wanted the kid to be brought to the hospital and forced medication. The kid was fine for 8 weeks, no symptoms of mania, no symptoms of any of this, but he had been labeled by prior providers and hospitals and filled with, antipsychotics until some point that he refused to take the medication. And all of a sudden he's fine. Wow, cool. And so, it's that kind of thing. Bipolar can be misconstrued with severe depression, right? What they're saying is mania. It might not be mania. The kid's just been pent up, right? And he's just letting loose. And so it really is important to recognize that the symptoms drive the overall label, and we miss that. And so when you talk about these new diagnoses, to me, there's always a fad, right? The fad was like ADD. And then now everyone's got ADHD. Now everyone has Asperger's. Oh, but Asperger's now gone. Okay, fine. Now everybody has, whatever the next most popular thing is. And for me, that's based off, again, people who don't have enough time, serving people who are underserved, not having enough time to look at the diagnostics, and going, you know what, I keep hearing about this overall diagnosis. Hey, it kind of fits, just go with it.
Yeah, push them into that.
And the most misconstrued diagnostics are ADHD versus spectrum. Spectrum kids play into so many different diagnostics and go unnoticed almost till teenagers.
Wow.
Because they're so smart at mimicking. But they don't actually intuitively understand how social norms work. Yeah. And when they become teenagers, the rules change, right? When you're a kid, teacher's sad, she looks sad. When a kid's upset, they cry. When mom's angry, she shouts, right? You have to behave to get this. You have to do this to get that. The rules are simple. So as kids, you don't always see misbehaving. You sometimes do. But then they become teenagers. When she's crying, she's happy. When he says this is cool, you're not supposed to do that. When my dad says don't curse, he does. When my mom
says confusing.
She's happy, it becomes confusing. And so these kids become very explosive. They're angry. They're frustrated. You're inconsistent. And so they get these kids like, oh, he's bipolar. He's manic. He's this. He's that. He's so explosive. We can't control him. I'm like, well, let's start with structure. Let's start with basics. Let's start with consistency. So it is very important that parents recognize that their providers may not have enough time. And so it's important for parents to come to the providers with data.
Okay.
They just don't have data. Okay, here's what I've been seeing for this amount of time. Here's a list of everything I've observed, right? You can feed your provider data and they have more information to work with. Otherwise, you're sitting across a teenager or a kid for 15 minutes. The kid's not going to tell you what they're dealing with. So you're gonna grab as much as you can and throw medicine at it. And then if it's the wrong medicine, now the issues are compounded. And then you throw medicine at that to fix that, and then that to fix that, and that to fix that. And then you have a very disgruntled and thrown off teenager.
Wow.
So that's my 5 minutes.
Interesting. What a good answer. And I mean, I inherently agree with quite a few of statements that you made there. And yeah, thank you so much for just laying that out in a more simple way, to not be a label as an identity, but to be a diagnostic as symptoms. Sure. And I just think that's powerful, because it gives you power back as the client, as the person who's struggling, as the family, the parents.
Correct.
Absolutely.
Yeah.
Well, thank you so much for your time. This was really, really wonderful. And yeah, I want to leave the episode with a few resources for parents or teenagers who may be, listening and not sure where to turn. I in particular, I work with NAMI Southern Nevada, the National Mental Illness. Yeah. I love them. They have a teen youth support group that they just started just a couple months ago. They also have like a teen text line. So really trying to help out. And then they offer Ending the Silence presentations for schools. And so really trying to, get that education out there. So that's all free resources, but I know, there are lots of other resources. So why don't you tell us a little bit more about how people can get in contact with you, maybe other resources that you know about, and if anybody is struggling, how they can reach out.
Yeah. For me, I have a website. It's mendibaron.com, mendibaron.com. My company in Las Vegas, which deals with teen mental health, is Moriah Behavioral Health. That's MORIAH behavioralhealth.com. NAMI is an excellent resource. There are quite a few youth organizations that have opened up in Nevada that have had a lot of success, which I can probably send you a list and you can publish with the episode.
I'd love to.
There are some nationwide groups that have been really terrific. In California, there was a group, which I don't know if it's spread around, but it's called Billy Because I Love You. And it's a parent support group primarily around addiction. There's, Al-Anon for those who deal with addiction, right? AA is for obviously people struggling with addiction, but Al-Anon's for the families of people struggling with addiction. And so you can meet other people and talk about things. People have been through the same things that you may be going through right now. You ideally should try to reach out to various therapeutic groups in the area. There are quite a few of those in Nevada. And you can reach out to your school and ask for resources. Even if schools don't have their own resources, they tend to have a list of resources, and that can be helpful. And sometimes Google can be your friend, sometimes not. I wouldn't Google symptoms, but I Google providers. And then you can go from there.
Wonderful. Thank you. That's perfect. That's an excellent list of resources to get people going. And yeah, and I hope that this episode was helpful for everyone out there. And I'm just so excited that you were able to come on, Mendi, and to talk more about this really important topic. And I just appreciate your time. And we'll see everybody next time. We are live every first and third Wednesday of the month here on PR Connections. But you can catch all of our episodes at katierosewechter.com. Thanks, everyone. Have a great one.
Take care.
PR Connections Radio thanks you for watching this podcast. Check out more episodes of this show and our others at prconnectionsradio.com.